All right, welcome back. It is the Vegas Take. Sharp and Shapiro. Glad you could join us on a Thursday. Don't worry, we'll get to more of your calls coming up here in a little bit, but a very special guest we have on the line with us right now. You know, you hear from politicians, you hear from people that are actually not on the front lines, the people, the heroes, right? The nurses, the doctors, you know, the paramedics, you name it. There are people out there that are on the front lines that are doing such a great job. And the woman we have with us on the line right now, she is an ICU nurse. She works at Saint Rose Dominican Hospital, where they literally are saving lives right now and doing what they can to help people. Toni Stockman joining us right now on the line. Toni, thank you so much for joining us. How are you?
Thanks a lot, Toni.
I'm okay. Thanks for having me.
Yeah, I appreciate it. A lot of questions to get to in a short period of time. I don't think people realize what you are going through there. So let's start this. Can you lay the scene out for us? What is it like going into Saint Rose Dominican Hospital right now, treating some of these patients? What are some of the difficulties that you and some of your colleagues are having to deal with right here in Las Vegas?
Well, I think the biggest difficulty is just making sure that we're protected to be able to take these patients. You know, the acuity in the hospital is just increasing every day. And for weeks now, we've been actually asking leadership and administration to make sure that we have the proper protective equipment to care for these patients. And up until 2 days ago, many units, including mine, were not allowed to wear the proper N95 or PPE masks, that they're air purifying respirators, in the proper way. Basically, all of these protective equipment are designed for one use only, and we're being asked now we get one N95 a shift. We need to reuse it and put it in a paper bag. Gowns we're reusing. Everything is locked up in a room. Every kind of equipment, from gloves to gowns to eye shields to masks, are locked up in a room, and we need to go through our management to actually access it.
Why is it locked up in a room? Why? What is the explanation you're getting?
Well, what I've been told by leadership up until just over the weekend is that we have enough. We just need to use it responsibly. But look, I don't know any nurses or any other healthcare staff that are using the protective equipment irresponsibly. They say that we have enough. I've been told that directly by our nursing leadership, but it's still locked up. We have to wait to take care of our patients to get the proper protection. And, I don't know. They're just saying we need to make sure that, it's not going anywhere. Well, we need to use it. And up until 2 days ago, now that everybody can have one mask a shift, which is still not proper, people were getting exposed. And, we're having, more and more sick patients, and we don't know if we're getting sick. Or
I wanted to ask you about that, Toni, because as you know, there are some stories throughout the country where some of the great nurses and doctors are getting exposed and they don't even know it. And then they test positive weeks later because there's not enough testing. How concerned are you about that? And do you know of any of those doctors or nurses that have been exposed to it? Maybe they didn't know.
I'm extremely concerned, as well as, all my colleagues that I work with, that we have been exposed. I know for a fact I have been exposed. And I don't know anyone specifically who has tested positive. I was called by employee health yesterday and said that I had been exposed to a patient, but as long as I, wasn't having symptoms or anything like that, just monitor myself and continue working. I wasn't offered a test or anything. I know throughout the country there are several nurses and doctors who have even died from this. Yeah. And it's as a nurse, as an ICU bedside nurse, I only know what I go into every day, and that's that I need to take care of these patients and do the best I can to do that. And if it was my family there, I want to make sure that the nurses are advocating 100% and making sure they have the equipment to do so, to take care of my family member. And quite frankly, overall, it's just not 100% happening. And our hospitals really need to do more to protect us.
Do you have any idea what the testing capacity of your particular hospital is on a per-day basis?
I have no idea. That information obviously isn't shared with us. And
Sure.
With all the days and nights that we've all been working to take care of these patients, we barely have enough time to breathe and sleep and eat.
I don't doubt that at all. If you're just joining us, we're speaking with Toni Stockman. She's an ICU nurse at Saint Rose Dominican Hospital. She is on the front lines. Let's talk a little bit about ventilators. We've heard it throughout the country, particularly in states like New York and New Jersey, where they don't feel like they have enough ventilators. Tell us the situation over there at Saint Rose. Do you guys have enough ventilators? How many people have you seen on ventilators? And are you worried that you may run out?
I personally am worried that we may run out. I've not been told specifically how much we have. It's just hearsay from our respiratory therapist. But I can tell you that one of our ICUs at San Martin is completely full of either positive or suspected positive patients. They are all on ventilators. In our other unit, we do have some on ventilators. I don't know. I don't know the numbers. I hope that we have enough, but I can tell you the way that the acuity is increasing, I'm really worried that we're not going to. I'm not sure about the other campuses, but I know at mine, it looks like we may have a few more, but I don't know that for a fact.
What condition do COVID-19 patients typically have to be in to be considered a candidate to go to an ICU and to get a ventilator at your particular hospital?
Basically, just breathing difficulties, and that's what accelerates them from maybe just being on a regular medical surgical floor where they might just need a little bit of oxygen and they go very, very fast. So it's very minimal, a few times that they may go to an intermediate care. They're usually from needing just a little bit of oxygen to full-blown, maximum support on a ventilator. And
Sure.
We're just seeing that more and more. And there's really no in-between. If they have to be on oxygen, they may be able to stay at home. But once it gets so bad that they need full ventilator support, that's when we see them in the ICU.
So I don't want to ask a political question, but this is a question I have to ask because, you're a hero. Make no mistake about it, Toni. You and all the other good doctors and people that are working in hospitals, not just in Las Vegas, but, of course, throughout the country, throughout the world. The president made a statement several days ago alluding to the fact that he believes that employees are going out the back door, quote, possibly with, masks and other possible equipment in these hospitals. So I want to ask you that specific question. Have you seen any employees or anybody steal or take anything? And what do you make of that comment by the President of the United States?
Quite frankly, I'm appalled. He is not a frontline worker. He does not know what we go through every day. Nurses and other staff, doctors, respiratory therapists, everybody else, are, to me, my heroes and my colleagues that I work with. I have not seen that ever happening. And I just don't understand. He says that, it goes from, I don't know, I'll just throw a number out there, 100,000 masks to now, 1 million or something. Where are they going? Well, the acuity is getting higher. People are getting sicker. People are dying. And we don't have enough. When we have to keep reusing these same masks of the same gowns and equipment, I've not seen it. I'm appalled that he said it. And I wish he would just stick to the facts and know what he's talking about, quite frankly. My opinion.
Have you been given any type of drugs? And there's been a lot of talk of hydroxychloroquine and azithromycin as a type of prophylaxis for, a preventative measure for people that work in the healthcare industry. Has that been discussed with you at all? Have you been given any types of drugs to prevent you from getting the drug or to getting the virus?
Absolutely not. And, to my knowledge, there's not scientific evidence that it actually does work. I don't know. I think now is not, the time to just be using people as, lab rats either. Quite frankly, that's what I feel that, us nurses on the front line are being used as lab rats too, to not be given the proper equipment to take care of these patients. Just throwing us into war without any protection is not acceptable.
Toni, let me just say I completely 100% agree with you on that, and we've debated that on this show plenty of times. I want to ask you this, and again, if you're just joining us, Toni Stockman, an ICU nurse right here at Saint Rose Dominican Hospital. I can't imagine what you're going through personally. I want you to go through that with us because As I said before, and I think I need to say it again, you're a hero, and all the people on the front line that are doing the great work and saving lives, you're a hero. What is it like going into a hospital, not a regular day, not a normal everyday where you're still saving lives? This is a different circumstance. You don't know whether you're going to contract the virus. You don't know if you're going to put your family in harm's way, and you're doing it and making a sacrifice for the good of the American people and the people here in Las Vegas that are going into Saint Rose. Just talk to me about the emotion and the trials and tribulations that you're just going through personally yourself, going to work every day.
I'll try to say it without getting so emotional, but I have to thank you for asking that. Personally, I'm worried. I've sent my son to live with someone else for almost 3 weeks now. I miss him. I'm hoping he can come home soon. My husband, every night or day, I come home. We just start talking about it. He works at the airport, and obviously it's a ghost town there, but he's a crew chief, and he needs to be taking care of, how many planes they have and, making sure that the work gets done. Just being paranoid, not paranoid, just overly cautious. When we come home, we wipe everything down. I'm in tears. I'm telling them just about my day, what I've been through. And, thank goodness I have a strong support system when I come home. But I worry that I'm going to bring it home to my family. And I just don't understand. I just don't understand why this is happening, quite frankly. Physically, emotionally, I'm drained. I'm exhausted. I'm worried. And I just really don't know what else to say other than I just have to do what. Of course, I never signed up to take care of patients not protected, but honestly, they need us, and we need to protect our community. That's what I'm really worried about. Look what it's doing to our community. I mean, I can't even go out and find, just like everybody else, toilet paper, hand sanitizer, wipes. My husband's making his own sanitizer and alcohol wipes to wipe down the house several times a day.
I have a serious problem with that. You're one of our heroes, and you can't even find hand sanitizer. To me, that is that's just incredible. Well, I think you said enough, but it's important for you to share your story, and I think it's our politicians and our leaders that need to hear the trials and tribulations that you're going through. This will be my last question for you, Toni, and I appreciate you coming on. If you had a chance to speak to the President of the United States right now, and you're in front of that microphone in front of the White House, and you're speaking not only to the American people, but to our politicians and to our lawmakers, what are some of the most important things that you would want to convey to him as being on the front lines? What would you say to President Trump right now?
Well, I think that, he finally, from what I've seen, has got it. Instead of poo-pooing it away for the last several weeks and even months, when we as nurses and our nursing union has, brought this to fruition of what is to come. I want him to take this seriously. I want him to use his full presidential power to, unleash, his powers for the Defense Production Act, basically. This bill, or I don't know so much about it, but, there was a stimulus bill basically putting all this money out there. A lot of that money goes to the hospitals. Why would, with no earmarks on there, why would hospitals need to be making money? He needs to make sure that hospitals or, companies are making this PPE that we need so desperately. And, quit saying that it's going to go away. It's just going to go away. It's not going away. It's not like the flu. Stop, spreading misinformation. And the thing that really bothers me is that people don't go to find the information correctly. They just believe what he says. It's astounding. It's appalling. And as a frontline worker, I just wish he would stop.
Yeah, I couldn't agree.
Let the scientists and the professionals do the talking because they know what they're talking about. He does.
Exactly. So well said. And let me be clear. You're the type of people that I want to hear from, not the MyPillow guy. I just want to be clear on that. I want to hear from Dr. Fauci. I want to hear from the good people on the front lines like yourself. Toni, first of all, let me just say it again. Thank you so much for what you do, putting yourself in harm's way to save others. Make no mistake about it. You are a hero, and we want to thank you for what you do. And I'll tell you something. We love the information that you gave us, and maybe within in a few weeks or so, maybe we'll have some positive news. But we'd love to have you on again down the road, and we really do appreciate your time. Keep up the great work that you're doing, and we hope you and your family and friends stay safe. Okay?
Thank you so much. I appreciate it.
We appreciate you. Thank you so much.
Thanks a lot, Toni.
Yeah, really a pleasure to have her on. And boy, you can hear it in her voice how difficult her job is.